There were a couple of strong themes in the session, but we started with one study from Belgium that was on its own. It looked at azithromycin given chronically for patients with COPD suffering exacerbations. What was different about their study was that the azithromycin was started during the patient's hospitalization, just prior to discharge. It was a 3-month intervention, and I was intrigued to see that although the results were not statistically significant in the end for the primary endpoint, small study, the effect was positive. It carried over for at least a month after the 3 months, and it did tend to decrease healthcare utilization. So we'll continue to explore those chronic antibiotic therapies, the macrolides, for frequent exacerbators. Triple therapy for COPD was also a theme, and we saw that in a couple of ways. Professor Leo Fabri from Modena, Italy, looked at a post hoc analysis of the ultrafine aerosol triple therapy trials and found a tendency to decrease mortality in COPD patients, and the interesting thing, it was non-respiratory deaths. Now, that's a post hoc analysis, but it is tantalizing, and that is the holy grail, if you will, of COPD research. We heard as well about the Chronos study. It was a look at triple therapy versus double therapies, also strongly positive. It was associated with decreased exacerbation rates, that is the triple therapy. Interesting thing is, a little discordant from some of the other studies, this was not a frequently exacerbating population, and that study's just appeared in full in the journal, so we're going to be looking at that closely. Presented by Gary Ferguson. We also saw some interesting data about early clinical trial results in two very different ways. From the old TORCH trial, we saw an analysis showing that patients who failed clinically in the first 6 months had increased healthcare utilization associated with increased costs in the subsequent 2.5 years of that TORCH trial. The other look was in the other direction, presented by Kostas Kostakis, looking at the FLAME trial, the very successful trial of LABA-LAMA versus ICS-LABA, and he was able to show with a post hoc analysis that patients who had clinical improvements or good outcomes at the beginning of the trial were the ones who tended to have good outcomes and decreased exacerbations in the subsequent part of the trial. So an interesting notion about how we assess our therapeutic interventions. Early results tend to predict late results. And then finally, another on its own, a look at a novel anticholinergic presented by Jim Donohue, and I think you've also got his interview on file. So we saw that with the very successful revefenacin, I believe it's called, at the higher dose, not only the improved FEV1 you would associate with a LAMA in COPD, but also decreased exacerbations.